What is subcutaneous panniculitic-like T-cell lymphoma? Cutaneous T-cell lymphomas are a group of non-Hodgkin's lymphomas that occur primarily in the skin. There's several different types, and subcutaneous panniculitic-like T-cell lymphoma is a lymphoma that's centered in the fat that sits right under your skin. So people will often have firm, tender areas that you can feel in the skin more than what you can see. They're often on the upper arms and the thighs. How is this different from cutaneous T-cell lymphoma? So when we think of cutaneous T-cell lymphoma, we mostly think of mycosis fungoides and Sézary syndrome. And those are diseases where we mostly see patches or raised red areas on the surface of the skin. Subcutaneous panniculitic-like T-cell lymphoma, we feel hard, firm nodules underneath the skin. And sometimes our patients with subcutaneous panniculitic-like T-cell lymphoma will have fevers and abnormal blood tests with their firm nodules under the skin. What does it look like? Subacute panniculitic-like T-cell lymphoma is something that you might feel more than you can see. Sometimes the surface of the skin will be a little bit red, but mostly you'll run your hands over your skin and you will feel firm nodules or thickenings that you have to rub on pretty aggressively to feel them under the skin. Commonly, we see them in areas where the body has more fat. So sometimes the upper arms, sometimes the thighs, sometimes the stomach, but they can occur anywhere. What are the treatment options? The treatment options for subacute panniculitic-like T-cell lymphoma are a little bit confusing because it's a recent category of cutaneous T-cell lymphoma. Typically, if the patient's feeling really bad in the beginning, we'll start with something like prednisone pills or some other oral steroid to make the patient feel better quickly. Then we'll typically try a pill medicine, something like methotrexate, which is used for psoriasis and rheumatoid arthritis. If that doesn't work, we may try bexarotene, which is another pill medicine that we use for mycosis fungoides and Sézary syndrome. If those treatments aren't effective, then we consider moving to IV medicines like single agent chemotherapy. What is the prognosis? The prognosis for subacute panniculitic-like T-cell lymphoma is also a little bit confusing because it used to be lumped together with a more aggressive form of subcutaneous lymphoma. So currently in the current classifications, if you're diagnosed with subacute panniculitic-like T-cell lymphoma, we anticipate you doing very, very well. There is a small group of people that will have fever and liver abnormalities, and those people may have a slightly worse prognosis. I think over the next few years, as these diseases are separated more, we'll have a better understanding of how the majority of our subacute panniculitic-like T-cell lymphoma patients are going to do.